101. TikTok Live number 40. We're getting started now. C. Benji just asked the first question. Going to be, just to remind everyone, the top 3 listeners that listen to the longest on this episode, I give a shout out to you guys in the comment section, in the caption section of the YouTube and podcast post, the long form post. All right, friends, let's get after it. Let's get after it right now. Going back to C. Benji's question. And guys, keep the questions going in the chat. Let's do this. TikTok Live number 40. Let's begin. C. Benji asked, how old was the oldest person in your DDS program? I'm starting a bit late. Yeah, awesome. There were older people. The oldest person in my dental school was 36 years old. Yes. Actually, 2 people. One was early 30s, one was mid 30s, and the oldest was about 35, 36 years old. In my residency, the oldest person was 47. Yeah, 47-year-old going through the oral surgery program. Yeah, so there are plenty of people that switch, change careers, and go back. I think it's great. These people get a better sense of life at scale and what the real world is all about. I noticed that students going from school to school, education to education, without working in the real world, have a misunderstanding sometimes. Like, yeah, you need to know the business to an extent. You need to know the marketing to an extent. You can't just expect a patient to arrive in the chair every single day, filling up all your appointment slots. You have to be able to market yourself, and you need to be able to understand the business so you don't go out of business and you can keep the next month going and the next month going. All right, friends, next question is Dr. Miguel. How did you pay for dental school? For dental school, fortunately, I was able to receive some help from my parents, and then I would have to pay for everything outside of school, for rent, for groceries, for gas getting to and from school, for transportation, for study materials, books, apps. I had to pay for those things, and my parents I was very fortunate that they were able to help me with tuition a bit there. Yep. Unfortunately, I'm an only child. I wish I would have had siblings and had debt right now, because I think siblings are much more important. But that's what we're given. We got one life. We got to make use of everything we got with it, right? Make the best of the opportunity we're given. User 95267 said, how was med school? I didn't go to med school. I went to dental school. And in my 4-year oral surgery track, we aren't required to get an MD. It doesn't help you out as an oral surgeon. So I don't know. I didn't want to get it. I'm not getting it. I'm going right through 4-year residency program in oral maxillofacial surgery, and then I could work. Raul said, can a foreign OMFS work in the U.S.? You need to repeat 2 years of dental school and then apply. You need to get your training registered, and accredited in the United States in order to work as an oral surgeon outside of a hospital or dental school program, right? So you'd have to redo everything in the United States. That's how you'd be able to do it. Dilara said, do you want to work in an outpatient setting after residency? Oh yeah, I really do. I don't want any work in hospitals anymore after this. And the reason being is I've seen dentistry and, multiple specialties, multiple outpatient settings, inpatient settings, and the outpatient is so much better. The inpatient settings, hospital settings, residency work has just been, it's not an experience I would want to do twice. Carter, are you going to start your own practice after you finish residency? So Carter, I already signed in July. I signed with a multi-practice, private practice. So they have 6 offices. It's all county oral surgery on Long Island in New York. And I'll be in the Melville office starting August 15th, 2025. So next summer. But yeah, I'm going to be working there. I don't plan on starting from scratch. If I have to, I will. I'd really rather prove my worth to this multi-practice. Hopefully be given the opportunity to buy into it as a partner in a couple of years. And I'd like to go that direction. Yeah, I would. Vuki Boy said, did you find a job? Yeah, I did. Vuki Boy. That's a funny ad. I did. I am going to be starting at All County, in the Melville office of All County Oral Surgery on Long Island in New York. That'll be next August 2025. User 1471 said, thoughts on the perio specialty? Yeah, I think the perio specialty is generally pretty good. That being said, I think the confidence of some of the periodontists graduating these days, they don't have inpatient management experience. They don't have anesthesia experience. And I know some of them might be going into and dabbling into the conscious sedation area. I think it's very dangerous from an oral surgeon's perspective, spending 6 months on anesthesia, intubating a couple hundred people during residency, knowing what it takes, understanding complications, bronchospasms, laryngospasms, and more. I think the training that people get, periodontists, general dentists, of a light sedation or conscious sedation standpoint is minimal to none. And I don't know if they have the experience of what to do when a complication comes up. Perio, as a surgical specialty, I don't know if you could call someone a true surgeon unless they know and understand how to manage complications. But from the surgical standpoint of invasive procedures that periodontists do, I think it's a great specialty. I really do. So those are my 2 cents. They don't have to take call through their 3 years of residency if you work in a VA program. Generally, the treatment's paid for by the government. So a periodontics residency in a VA program would be the best way to go. And like I said, no call, no inpatient management. You're strictly focusing on outpatient procedures, which is generally what I want to do as an oral surgeon. But I know that my 4 years of experience in the setting of oral maxillofacial surgery in the hospital, in the residency, managing in the hospitals, in the clinics and such, I feel much more comfortable with complications, having seen them and handled them already. Complications that general dentists and even periodontists have had to send to us in the hospital setting. So I think from that standpoint, from a dental alveolar oral surgery standpoint, oral surgery was by far and away the way to go. But anyway, so that's just my take comparing oral surgery to perio. And I'm saying perio is an excellent specialty because you get to focus more on what you're going to be doing after residency. Angie Garcia said, what types of cases have you seen this past week in residency? Thank you and wish you the best. Thanks, Angie. Likewise. Hope you're doing good. Complications, mandible fractures, big major lacerations, several lacerations, a couple of them very large, very deep in critical places where vital structures can be hit. What else? Infections. Saw some infections. What else do we do? Major IPS. Did an IPS last week on a patient. That's when an edentulous patient, no teeth in the top. You get the gingiva out of the way and then you plate this massive prosthesis and you screw it like 20 screws to the maxilla, goes out to the zygomas on either side, and of the lateral piriform rims on the medial portions has some posts in the bottom, and then a prosthodontist will be able to latch a denture onto that. That's the IPS system by KLS, and it's a good procedure when patients don't have adequate bone and you need to go up higher in order to screw this subperiosteal implant in. That was a big one. JR said, what did you go for undergrad and dental school? Where did you go for undergrad and dental school? I started 2 years at NYU Polytechnic Institute of Engineering in Brooklyn. That's the Tandon School of Engineering at NYU now. Did 2 years there. I graduated in my last 2 years at Stevens Institute of Technology in Hoboken, New Jersey. And then I went to Stony Brook Dental School after that for 4 years there. Vuki Boy, can you extract any tooth? Yeah, Vuki Boy, I can extract any tooth. User 1471. I thought a lot of peri-residencies do have IV experience in patient. No. And the IV experience that they do, at least at all the programs that I see with perio, they're not able to place IV. When you place an IV, what are you doing? You're putting a catheter into the IV and then you're giving IV sedation medications. And yeah, the conscious sedation thing is no. On anesthesia, they observe for a month. An oral surgery resident does anesthesia for 6 months. That's the perio programs compared to oral surgery that I've seen. Okay, that's exactly what I've seen. All right. Next question is OMFS, is MD worth it? By Apple user 383. I didn't do it. Now, I'd be biased to tell you that, right? Because I didn't do that, but many people will say it's worth it. I think generally you kind of hear afterwards, after people graduate, that they don't use it. They don't use the MD in most cases when they're doing oral surgery. So that's something to consider, I just missed one. Where to go? Here we go. User 1471 had a decent amount of interviews at this cycle, and so I'm going to assume I get into dental school. Tips for D1. Yeah, enjoy. Once you get accepted, that sounds pretty confident. So once you do get accepted, I would just enjoy the rest of your year until you start. First off, in D1 dental students need to learn efficient versus effective studying, okay? And the difference is that effective studying is like getting higher scores, B to A plus, right? 85, 99. Efficient studying is when you can maintain those A's, saying 95, but study less and less and less. Study from 5 hours to 4 hours to 3 hours. That's efficient studying while maintaining those high scores. And why is that important? Because the transition from undergrad to dental school is the difference of 32 credits. So in undergrad, you're taking 12, 15, 20 credits perhaps. In dental school, they say it's the equivalent of about 32 credits a semester. So that's exactly why you want to get effective at your studying, which hopefully you have already, but then you're going to be doing efficient studying. Sometimes you're going to have 3 finals in a day. We had upwards of 5 tests, between quizzes and exams in a day during dental school. So that's going to be really important for you there. Here we go. Who's next, friend? Ethan, should I become a dentist? Well, what do you want to do? Next person, here we go. Ed, how can I go about to have my tooth whitening? I would go to a general dentist. I would go to your primary dentist and ask them about tooth whitening. And yeah, I am doing Movember. I am doing No Shave November with the mustache. Sure, prostate cancer awareness. Let's do that. That's something I'm going to be very passionate about in the years to come. Custom, because all my uncles got it, and all my all my uncles on my dad's side, my dad got it. Custom grow. Getting any wisdom tooth out in a week? Any advice? You're getting your wisdom teeth out in a week. Some advice? Yeah, just follow all the instructions. Okay, I don't know if you're getting sedation or not. I'm not going to tell you what to do. Think of this and that, but follow all the instructions that your oral surgeon gave you, and hopefully you're getting them out at an oral surgeon. 1942 said, dude thinks he's a doctor. All right. So, okay. JJ said, wait, your room is so cute. That's pretty cozy, right? It's a tiny little apartment in Manhattan. I got a really small one with the windows and stuff, but it's cozy, you know. I like it. I like it. Here we go. We got next is 0.0527 underscore IS. How many times can a tooth survive fillings? I mean, it depends on how big the fillings are. It depends on how many previous fillings. It depends on what other, pathology or issues are going on with that tooth. There's a lot that goes into that. Happy Face said, "Are you Irish?" Yeah, I'm Irish and German. There's definitely a mix of a bunch of things in there, but predominantly Irish and German. Dot said, "You don't even know how to trim a mustache." No, I don't actually. So cool. You win. You win. Go join someone else's live. Custom grow. Getting my wisdom teeth in a week. Any advice? I just answered that. So follow all the directions that your oral surgeon gave you prior, okay? Taylor Hart said, my temporary crown fell off. The dentist told me it should be okay. Is that normal? Sometimes the crowns fall off, and temporary crowns fall off more than permanent crowns, right? Makes sense? I would return to the general dentist and get that permanent crown placed as soon as possible. Knit Miller said, hi. Hi, Knit Miller. Carter said 32 credits a semester is crazy. Wow. Yeah, it's a lot. And that's why that effective studying is so important. You know what I mean? 6'6", were you a gunner in dental school? You know, unfortunately, I really didn't want to be. And I wasn't trying to be. I would assume that other people in the class might have described it as being a gunner. A gunner is someone who will sacrifice their relationships with others in order to get ahead, their GPA, their standing in the class, their ranking, perhaps. That's not something I did. Unfortunately, sometimes in a competitive environment, everyone may view certain actions differently. But no, generally, I tried to lead by action, and those actions included teamwork, studying in groups, pushing each other, motivating, and many people motivated me and stuck with me throughout dental school too. Some of my best friends in that class. But unfortunately, you see what I'm saying? Like what I'm getting to is that it's subjective. You know, how someone decides or judges your personality or your demeanor or attitude about something is unfortunately subjective. And you see a wide range of personalities in a dental school class, many type A's, and sometimes very little self-awareness or social awareness. What someone would call you is definitely going to be based on their opinion. Annette Miller said from Hawaii. All right. Aloha. Tulsi Gabbard's from Hawaii. Right on. I like that. Annette Miller also asked, where are we at? Why did you decide to become a dentist? Because it's a cleaner profession from the average doctor. Dentists generally have a better quality of life than doctors too. And now it's changing. It's becoming more corporate, but generally, historically, doctors work many times in hospital settings. Dentists work in outpatient office settings, right? I like that. It's cleaner. You generally get to have the opportunity to become your own boss, which is a big thing, a big reason of why I went into it. All these things. Ethan, why did you become a dentist? That's why. Melton RR, tips to improve cognitive function and learning. Adequate sleep, daily exercise. I would try and get 4 to 5 times a week minimum of exercise around your studying. Make sure I like to take caffeine or drink caffeine. I don't take caffeine. I drink caffeine. I drink a lot of coffee. I try to reserve coffee only for when I'm investing in myself, in my work and my learning, rather than just going to someone's work at like a 9 to 5. Well, now you're working for them. So if you're taking caffeine, you're improving function for them. But if I was going home and studying, preparing for interviews, or reading on my own to learn, then I would drink caffeine. Does that make sense? Abby, what's your biggest interview tip? My biggest interview tip would be it's not a multiple choice exam. It's a conversation, and make sure that you're having a conversation with your interviewer, right? That's super important. Jamice Klein as a D1, what should I prioritize? Now, to eventually specialize down the road, specifically OMFS or ortho, well, I would definitely get exposure to both of those specialties, but I would wait till later this year, D1 year, maybe D2 year. D1 year, you want to make sure that your grades are good, right? That's really just it. You should start thinking about the exams. You have to take the GRE, right? For ortho, and you have to take the CBSE. I wouldn't take them until after D1 year. But just to kind of look in mind what you're going to need to do. You're going to need to get that CBSE next for oral surgery. After that, you're going to need to do externships, all the while keeping your standing high. Yeah, so those are some things to do. Connor Gallagher, what's up? We got another Gallagher in the house. Had a patient with a subperiosteal abscess today. First time working with OMFS, was super cool, of the jaw. Yeah, subperiosteal just means that it's underneath the periosteum. We see those all the time. It could be just a little abscess, just a little collection. You can treat that with incision and drainage if it's appropriate. Otherwise, subperiosteal abscesses could blow up and really become big. But generally, that's when it's invading into different fascial spaces. CB said, what would happen if we neglect getting impacted wisdom teeth taken out? Well, it could turn into pathology over time. They could get infected depending on the impaction. They can cause, they could cause referred pain to the TMJ or other areas of the head and neck region and the ear. But generally, the most common thing of leaving wisdom teeth is, it could cause pericoronitis. It could get infected and cause an infection. And last but not least, I would say pathology. Even if it's fully impacted, it could become a cyst, such as a dentigerous cyst later down the road. So those are some things to look out for. A. Rush said, is becoming an EMT worth it in college if you're trying to go and become an OMFS? It's a good thing to have in your resume. EMT, you get a lot of experience. There's a lot of action, depending on where your shifts are located and how high level you're going. Is it worth doing in college? It's always worth doing that in college, and you're getting exposed to the medical and healthcare areas. But for OMFS specifically, not necessarily. Saqib said, did you pursue research during that undergrad? I did. I actually won a research award. I think the project that I got really lucky being on a really cool project with like Werner's helicase and aging and the nuclear pore complex by Dr. Glavy. There were a couple projects I got to work on, but it was really the PhD student who had an excellent project with Dr. Glavy, and they did a really good job, and I was able to assist and help out on that project. So when I submitted and created the presentation of what she was doing and where I helped her and whatnot, they found that I guess I got the award because they felt that it was a good presentation. They felt that the project was really helpful, and I thought it was pretty monumental. But I give the credit to the PhD student, and she was awesome to work with. She was really sweet. Sharma, MD, what are the indications of wisdom tooth removal? Well, if you have pericoronitis, if you have swelling, if it's erupted and generally easy to, if it's affecting the hygiene of the second molars in front of them, there's so many indications. These are few of them. Is it infected, or is it just pericoronitis? Is it causing pain? The hygiene. There's a number of things. Those are just a handful. Tajman Randhawa salary. My salary is about 75, 80,000 this year. After taxes, roughly 50 to 55,000. My rent is 34,000 to keep in mind. So that's only 15, 16,000 dollars like surplus a month that I have to live with. Not a month, for the year, divided up into the months. It's not that much. It's not that great. A resident salary is not great at all. It's very difficult to live in a city like Manhattan with such a tight squeeze of your salary and post taxes and whatnot. There's a lot going on. XOXO Nicole said, any advice? I'm in my first year of college and want to give up already. Well, it's never a good idea to give up. Giving attention to different areas of where you may be interested in is always good, but I wouldn't necessarily just drop out and give up. I would really look into what you want to do for a career and try and mold your undergraduate experience around that and towards that direction. All right. Mohamed Metwali 540. How hard is it to get into OMFS? Pretty hard. It's pretty hard. But if I can do it, I think anyone can do it. I think you can do it. It just, how much intelligence do you have? How much determination do you have to get it? Stuff like that. And are you a hard worker or are you lazy? Luke Jai said, is pediatrics competitive? Pediatrics is competitive. Michaela B followed the live creator. Thanks, Michaela. Not me 6116. Thank you for all the advice you've shared for reoccurring lockjaw. So scary to see. Yeah, it can be scary, but dude, now you know how to fix that and how to reduce that lockjaw is really doable. You know what I mean? So hopefully that helps. Hopefully you never have to experience it yourself or another. And if you do, you are able to help someone with that. By the way, real quick, the top 3 listeners who stay on the longest during this live, I'm recording this. I'll be posting it out on a podcast and YouTube channel later. I'll be giving you guys a shout out in the caption. All right. Junior H. Lover said, what did you major in for undergrad? It was chemical biology I graduated with from Stevens Institute of Technology. He also asked, and do you think the major matters? I honestly don't think the major matters. As long as you hit the prerequisites that you need to take the DAT to apply to dental school, you could really major in almost anything. You know what I mean? Taylor Hart said my dentist is inside a hospital because it's a dental school. I think that's pretty cool. It is pretty cool. You aren't your own boss when you're in that. Like 99% of the time, you're not your own boss. And you generally get paid less, unfortunately, which makes no sense because you're teaching kids and students and the future of the profession. But my opinions are for another day. Ashton said, I'm applying for dental school. My personality is the opposite of holier than thou, though. All right. I mean, that's not necessary. I don't think that's dependent on one another, but I think Ashton said, who says delinquents can't be professional? I don't even know what to say to that, man. But hey, if you have good standing, you work hard, apply if that's what you're interested in. Highlight King said D2 shooting for ortho. If I were to have founded a startup that's comparable money to ortho, stuck, well, I mean, do it. Create a startup that's comparable to ortho, and I think that would be a pretty awesome pathway. Ethan, can you get into grad school after 1 year of undergrad and then you took dual credits, 76 hours in high school? Great question. I don't think so, but if you can, dude, give it a shot. JFCJD said, hey doc, how is the busy rotation going? Any cool cases? What's up, man? Yeah, and thanks for mentioning that. Busy rotation is going well. Unfortunately, my more orthognathic case, I had 3 to go to this rotation. It's been tough. It's been really tough. I haven't been handed too many orthognathic cases. All of them are for my second go around in like April, May, so in the spring. I only had 3. 2 of them weren't ready, and then the third one literally just canceled and pushed their surgery back like 4 months, which is 3 months, which is just an absolute heartbreaker. So that's disappointing, but it's going well. Otherwise, getting some trauma. Hopefully, doing another trauma case tomorrow. Did a couple last week. Massive laceration last week. So it's going good. Doing a lot of surgery, but it's just incredible in like certain hospital settings, the amount of work and tasks and administrative work you need to do in order just to get that surgery in. It's kind of wild. It's kind of wild. AA Miracle said, how good does class president or other leadership roles look when applying to OMFS residency? It can't hurt. You know what I mean? As long as you did a good job and you have things to talk about and why you're passionate in those roles, it can hurt. It's good to show that you're involved and advocate for your class, for your profession, for, whether you're an ASDA, for example. IDK said, can you keep a relationship through dental school or medical school? Yeah. I know a lot of people that do keep a relationship. Yeah, definitely. Danny B said DS2 here. DS2 here, shooting for ortho if I were to have found it to start. DS2 here. Oh, Danny B, DS2 here. Recently having recession on my molars after starting a night guard trauma occlusion. I would look at that. And is it from the night guard? Well, then the night guard needs to change so that it's not pushing your gums down, if that is the cause. And I don't know that it is. Brushing too hard is also a common cause of gingival recession, and hard bristles, you should have the most soft bristles on your toothbrush to prevent gingival recession, for example. Could it be the night guard? It could be. I would look into that. Your general dentist should really adjust your night guard to prevent any recession. Yeah, that's important. IBSSIDD 23 asked, do you work with GPR residents in your hospital? Yes. And what are they involved in? They take tooth call, where it's just tooth issues. I'm in the emergency department. Otherwise, in their residency, they still do implants. They do fillings, they do crowns, they do implants, they do dentures, removable dentures, partial dentures, bridges, and stuff like that. Minor infection, incision drainages, and stuff. Yeah. Highlight King said, that's profitable, can't swing residency at startup now, so stuck. Just got to keep working on the startup until it is profitable. Sometimes you don't have to do either or also. This is a big Gary Vee thing. Try doing both. You need to have your day-to-day job, like the 9 to 5, quote unquote. And then your hobby should be pushing outside of those hours until it is comparable to what you're making, so that you can live off of that day-to-day. That's very important before you just branch out and go all in on it. BKane_15 had all my wisdom teeth removed when I was 15. Recent x-rays in my 30s show they regrew. How? You might have had supernumerary teeth. I've never heard of that growing. Wisdom teeth regrowing? I don't know about that. Sounds like a myth to me. Andrew said, what product do you use for bone grafting? You could use like Zoomer Biomet. I do prefer the small particulate, not anything greater than like 0.5 of a millimeter. Those things are huge. 0.5 to 0.75 millimeters bone grafting is huge. It's like placing wood chips in like a hole. You want bone grafting particulate where it's like fine sand. I think that's like 0.25, 0.1 to 0.25 millimeters. I think that's, correct me if I'm wrong, but I think that's you want the smaller one. I've seen these giant wood chip size, they don't work as well. A Miracle said, do you need to be exceptionally smart to be an OMFS, or does hard work suffice? I would say both. I would say probably both. Guys, real quick, top 3 listeners on the live. This is TikTok live number 40, by the way. The top 3, I'll be giving you a shout out in the caption when I post the long form to YouTube channels and podcasts. Maddie said, do you think dental school has been worth it? Well, not out yet. I'm still in residency, but I graduate in 7 months. So after then, and I start working, get into the real world, hopefully get a better quality of life than right now in residency. I'll be able to let you know. Yeah, that's fair, right? Andrea Correa said, Owen Hunt. I get that a lot. Luke Haganman said, what's up, Luke? Where'd it go? What makes a patient candidate for the KLS Martin subperiosteal implant system? Well, severe maxillary atrophy, however, bone superior to that, where you can place roughly 16 to 25 of those mini screws to hold the subperiosteal implant in from everywhere between the zygomas, piriform rim, the maxilla. There's a number of things to see if they're a candidate, but also they have to be healthy enough to get this under anesthesia, stuff like that. JD, hey doc, how's the dissertation ankle case? Yep, I mentioned that. Any all-on cases? Hey, I'm at 16 all-on-X cases in the last 2 years or so, and I still have 7 months left, so I'll be getting a lot more, which is pretty great. Smahan said, when you put a 24-gauge wire in a fish loop, what did you all use for in a mandible orifice? Well, you could place plates in an open reduction internal fixation, right? We don't use wires anymore to repair mandible fractures. I'm trying to understand your question a little bit better. Justin said, can I still get into dental school if I failed a prerequisite and got an A after retaking? I don't see why not. I mean, I'm not an admissions counselor, but it sounds fine to me. Ethan says, stands out the most when applying for dental school. Ethan asked, what stands out the most when applying for dental school? Obviously, GPA, your DAT score, your ranking, your letters of recommendation, things like that stand out pretty high. Your shadowing hours, who wrote your letters of recommendation? Are there any faculty members at your school that were part-time outside and you shadowed at their office and they wrote your letter of recommendation? That's a key trick if you're applying to dental school. Cody Fitz, thoughts on a GP extracting teeth and placing implants? Well, I know many that do that just fine. It depends on the tooth. It depends on the anatomy, how extensive the medical history is, like how complex the medical history is of the patient. There's a lot that's involved with this. HSHGF, how do you decide where to rank programs when you're developing your rank list? Really, you want to look at which programs allow you to get the training and experience you're most interested in doing after graduating, right? Then you have to factor in tuition stuff if that's a factor, location, how many years it will be, what faculty members you will work with. Are they mentors? Is it a location near maybe where you want to get jobs afterwards? Because how are you going to interview if you're not in the area? There's so much that goes into it to consider. Ethan, did you ever think about quitting dental school? Yeah, I did think about it. Ethan, what's the worst and best part of your job? Worst part is I'm still in residency. I'm not in my own job and workplace yet. I'm really looking forward to that afterwards. Best part is I really like doing surgery. I've done so many laceration repairs and it's a cosmetic thing, and you're taking trauma and it's like you can only improve it from this moment. And I like to do a good job at improving that. So I do like doing facial trauma. I find that it's fun to put back together things that are broken or that need to be fixed. I like all-on-X cases, full mouth rehabilitation and reconstruction. I do like to work in interdisciplinary settings. I like to work with other specialties. Prost, for example, a general dentist, for example, who can restore those all-on-X cases. That's something I'm looking forward to out in a private practice setting down the road. A little bit longer, and then I gotta sign off, guys. Chrissy A, follow the live creator. Thank you. This is TikTok Live number 40, by the way. You can check this out later. I'm recording it for podcast and YouTube. Ethan, what stands out the most when applying for scholarships? That I'm not sure. That's a good question. Great Design 8, new grad. Where'd it go? Here we go. New grad who hates working at a DSO, no mentorship, and no good CE. Considering go back for an AEGD. Do it. Or apply to look at other private practice settings around the area that you'd be interested in working in. Some of them could be mentors to you, That's another option as well. Pre-dental, what's up, Luke? In interviews, were you asked about what you did during your gap year? Oh, all the time. And I mean, my gap year was stacked between working 3 different jobs, 2 lifeguarding jobs, 1 as a surgical assistant at an oral surgeon's office, reading books, doing the stock market, producing music I did. And then, a lot of podcasts I listened to. Should have started my podcast back then, honestly. But yeah. Ethan, how expensive is dental school? It's very expensive. You'll see anywhere from the 30s and 40s of tuition all the way up to Like NYU is like around $125,000 a year, including everything, rent and stuff. Ashton, is there a lot of drama in dental school? There is, unfortunately. I hate drama. I can't stand it. There is a lot of drama. How do you navigate maintaining good relationships with everyone? Well, one trick that I found, especially in dental school, is seeing is believing. So, what do I mean by that? If you go home directly into your room and then just start studying alone and everything every night, you work out by yourself, doing that, you start to become like a suspect. It's like weird. The drama of dental school, they start to point fingers at other people who are like it, because it comes off as shady. If there are big groups doing things together and you just kind of stay by yourself, which is fine, right? But sometimes that I notice in bigger groups of the dental school, they start to look at like that's shady. Oh, what are they doing? This and that. It's just part of the drama of the class. So for me personally, I found that studying in front of other people where you could be seen, you're found, they see you in the library, they see you at Panera Bread, they see you at Starbucks. It's like you don't have anything to hide. You're out there studying, working hard like everyone else in dental school, and other students see that, they believe it. It's like you can't point a finger at them because it's like he's studying in Starbucks every single day, at Panera Bread every single day. He's a hard worker. That's what, you know what I mean? So that's proof to the pudding of something that I found out. Countryside Farmer said, "Are you related to the Gallagher on Shameless?" No, I am definitely not. They did not give the Gallaghers a good name. Ashton said, "Peers/professors." Ethan, what is the best specialty in dentistry? Well, that's very subjective, right? Personally, I do think oral surgery. And here we are. Justin, how old were you when you finished undergrad? I was 21. 21, 22. 21, I think. I think it was 21. It might have been 22. When did you apply to dental school? I applied in 2016, and then I started dental school in 2017. T, how was the CBSE? T, the CBSE is that was one of the hardest exams I've taken. Yeah. User 7356. Are you able to work in an office as a dentist while in residency? In certain programs, in certain states, you can. In Manhattan, in New York, you can't. Ross Alex. Does a crossbite always require jaw surgery? No, not necessarily. Sometimes orthodontics can fix crossbites. If they can't, then that might be classified from, it can correct dental deformities just of the teeth. If the orthodontist does the best they can and it can't be corrected, it might be classified in the realm of a skeletal deformity, and that generally needs to be corrected by surgery, unfortunately. User 7356, also do pass-fail schools make a difference for getting into residency? Well, if you look at those schools that are pass-fail, generally they're like very high-level schools. Harvard, Columbia, UPenn, I think UConn is pass-fail as well. Stony Brook is not pass-fail. It's graded, but it's non-ranked. And a lot of these schools, these are schools in my area, right? They have better placement into specialties. So sometimes it does help getting into a residency. NJDDS Jr., what's up? This is Dr. Castro. He's one of my initial he's my back to the beginning. I met him in the gym. Dr. Castro and Dr. Capuano, an oral surgeon. Those two guys, two of three, they used to call them the Men in Black, three dentists that would go to the gym in the morning. When I was in undergrad, I used to talk to them. This is Dr. Nicastro. This is Nick. He was my original mentor. That is awesome. And so Dr. Nicastro said, now I need to grow a mustache. Dr. Nicastro, it's just for November. I'm doing the no shave November with the mustache. But you should do it. It's a little late now. We could do it next year. That would be fun. We got to do a race again, by the way. We need to run. And we got to do a podcast soon, too, actually. In 3 weeks, I get off the busy rotation. We got to plan another podcast, Dr. Nicastro. GT said, where is it? What motivates you to be great? It's exciting. It's something to look forward to. It's always good to be competitive with yourself, especially, and beat yesterday's agenda. I have a big list that I use, the Microsoft To Do. It's an app. It's like a to-do list and a calendar all in one. And I like to fill out as many things on my to-do list as possible. And that's, I don't know, I find that to be pretty exciting. I got my laundry going. All right, guys, a couple more questions, then I'm going to sign off. Tiana said, trust me, please. Okay. JFCJ, do you prefer freehand implant placement or guided? Well, it really depends. If we're going around certain structures, the mental foramen, we're going around the inferior nerve, it's a nice sharp ridge, not a lot of bone, then maybe guided implant placement is considered to be better, right? Freehand placement is like you got a lot of bone, you got nothing to worry about. It's a slam dunk. You do 100 of these a day, then maybe freehand is better. Ethan followed the live creator. Thanks, Ethan. Justin, have you done any LaForte cases to pull the maxilla forward, customize, place, etc.? Yes, I have done several of them. Ethan, what makes you so mad about the dental school curriculum? There's a lot that goes into it. It's becoming more didactic and less clinical. And as we know, dentistry is a clinical predominant profession. So dental school should probably be predominantly clinical and working with patients, not stuck in a classroom, right? But there's this trend because there's been like no increase in treatment reimbursement from insurance companies. So dental schools haven't gotten paid an increase in payment for seeing patients in like 20, 30, 40 years in some cases. And unfortunately now you could see it. I mean, it's obvious. They keep increasing the class sizes year after year, not increasing the patient base. They're making money off students now and less off of patient care. And you can always say like, well, it's not about making money off of patients. No. But you need to incentivize patient care. The incentive right now is just shove more students in the classroom and the same amount of patients get seen. You want to be seeing more people, right? You want to help more people, right? We're on the same page now. You need to incentivize that. We need insurance companies to be increasing the reimbursement rates. That's the only way you're going to get more dentists to do more work, more patients to get more treatment. And there are plenty of patients that need treatment. In fact, in some cases, more than ever right now. And in some cases, there's so much lack of access to those resources. And it's not necessarily location. People can literally get access to it, but insurance, they're not covering the same treatment. They're not reimbursing the same way. And it's a big nightmare. It's a big nightmare. It needs to be fixed. B, are you John Feidelberg? I don't know what that is. No, I don't. Foud followed the live creator. Thanks, Foud. Ethan said, does mewing change your alignment? Mewing? What? Radner said handsome and smart. Pat Lawson said thoughts on how much a hygiene department should produce. Do you look at them as a revenue source? Oh, I'm not sure. I'm not going to have a hygienist in my oral surgery office. Max Abramson, how competitive are GPRs in Manhattan? Pretty competitive from what I understand, but they are able to get into. Fowd said, do you do a crazy amount of stuff outside your normal resident work for some OS residents? Can't even lie. Yeah, I mean, you got to work, right? I want to be a partner in a practice one day. You got to work. You have to understand the business and the marketing, not just oral surgery or dentistry, right? You need to understand these things if you're going to be an owner. You don't need to understand these things if you're going to be an administrator, if you're going to be just a surgeon in the practice, just a dentist in the practice. You will most likely end up working for someone else, especially in a landscape that's very, very consolidated, like 2024 and the era that we're going into, unfortunately. It's not what I wanted to get into. I wanted to have a nice little mom and pop shop, maybe a couple partners, treating the patients. It's a very competitive specialty now. It's not what it was 5-10 years ago. It's changing, and you need to be able to adapt and make sure you can find a place for yourself in this ever-expanding profession. Yep, and healthcare fear. All right, friends, one more. Okay, Mickey 420, can you briefly go over the differences between DDS and MD? Yeah, there are no differences between DDS and DMD. Harvard changed, is like 1870 something, and made DMD. Some schools followed suit. Harvard just wanted to be different, essentially. Any advice for studying for the CBSE? Study hard. Nick Nicastros has followed the live creator. Thanks, Nick. What's going on? JFCJD, do you plan on owning your own office in the future? You'd like to become a partner? Yeah, I want to become a partner. That's my goal. I really want to be a partner in a multi-practice and grow a nice organization that other great surgeons could be a part of. And I want it to be a better organization to work for and work in, both for patients and for the providers where they're excited to work there. Will Moorhead followed the live creator. Thanks, Will. Mohammed Anzar, please, how do you heal maxillary perforation? Can you pack gel foam? Well, I'm not sure what are you saying perforation into the sinus? Are you saying perforation into the gingiva? That can mean so many things. You know what I mean? It's Remy. How is the lifestyle of a surgical specialty in your opinion? In residency, not great. I'm attending medical school and you're considering a surgical specialty. It's a pretty poor lifestyle while you're in residency, honestly. After residency, it really depends on the specialty you're in. It could be plastic surgery, it could be ortho, it could be oral surgery, it could be ENT, it could be ophthalmology, it could be an oculoplastics resident. There's so many things you could do, and the lifestyle will vary significantly. Absolutely. Lowell and Harmony, how often do you do lives? I try and do once a week. On the weekends, when we have some extra time, like it's Sunday night, I already finished my presentation. It's ready to go for 7 a.m. Just going to go finish some errands, get some exercise in. 7:15. Yep, I'm going to sign off right now, actually. But yeah, I try to do one live a week. And top 3 listeners who listen to the podcast, I'm going to be giving you a shout out in the caption. I'll post this to YouTube and podcast platforms. Thanks for coming on again. And I'll see you soon. I'll see you soon for the next one, probably next weekend sometime. Happy Thanksgiving, everyone. Signing out now. All right, happy Thanksgiving.